I really, honestly did not think that I would get pregnant.
Upset, just scared.
I didn't trust anybody. I wouldn't let anybody get in.
I was angry. I was angry at myself. I was angry at everybody.
I think fear was the biggest feeling that I had.
You're watching this video right now because you have a decision to make. If you've talked with your friends and family about it, it seems everyone has a definite idea about what you should do. And while they all mean well, you will be the one to live with the decisions that you make today. You shouldn't feel surprised if you feel confused, or even scared, sad, or angry. And while not all women experience these emotions, many women have been just where you are right now. They can tell you how they felt and how they coped with their decision.
I was angry. I was angry at myself. I was angry at everybody.
I was shocked. I was scared. I was crying.
I didn't trust anybody. I wouldn't let anybody get in and get close to me. I kept my relationships on a surface level.
It was based on a lot of fear. Fear of the unknown, fear of not knowing where my baby would go if I put it up for adoption.
I didn't have any close friends. I kind of shut my family out of my life.
And so at 17, when I found out that I was pregnant, a whole array of emotions just overwhelmed me.
Just upset, just scared, and wondering what my mom was gonna think, and my dad, and everybody else.
I was very selfish. I thought, oh my gosh, I'm fixing to graduate, I'm gonna be going to college, what's happening? My parents are going to kill me. And I was thinking only of myself, just completely of myself.
Not knowing what to do when I wanted to be pregnant, just a million thoughts go through your head.
I think fear was the biggest feeling that I had then.
I feared gossip. I feared going into my job and people seeing that I was pregnant and I was single. And I just knew that those people would make fun of me and that they would just think I was just nothing.
Emotionally, I was on a roller coaster ride, wasn't sure who I could turn to, if anyone.
I guess I just couldn't come to accept that I had made a mistake, and I didn't want anybody else to know either.
I found out I was pregnant. My boyfriend at the time, I told him, and the next day he was gone. I told my parents the next day, and they pretty much disowned me, and so I for the next 8 months, struggled with what to do and how to do and just, the best decision not only for me but for my child.
I really, honestly did not think that I would get pregnant. I guess I was in denial that it's not going to happen to me.
And when you find out you're pregnant, it changes, it alters everything.
I just want this to be over. I just want this to not happen. This is a problem and I need to fix the problem or get rid of the problem.
It was really a very, very difficult, trying time for me because I hid the pregnancy for so long.
Knowing how other women have felt in your situation can help to make you feel less scared, less alone, but you still have a decision to make. Knowing the facts, just the bare, simple facts, can make it easier to see which way to go. You have 3 options. You can keep and parent your child, you can make an adoption plan for your baby, or you can have an abortion. Listen to the stories and feelings of these women who have all had to face that same decision.
I wanted to have an abortion just because of how everything happened.
I didn't know it had a heart, a brain, and all the other kind of organs. I didn't know. I just thought it was just something in there that was going to grow.
I saw him on the screen and I was like, that's like a person, because at first it was just like a problem, like somebody to take care of, and then it was a person, and then I didn't want to have an abortion.
When a woman misses her period, by the time that she knows that she's pregnant, she's about 6 weeks into her pregnancy. At that point, all the internal organs are already starting to be developed, such as the brain, the spinal column, the heart, the lungs, the abdomen, the kidneys, the stomach, and even the extremities where they can actually see little fingers and toes.
The time I saw the ultrasound, I saw like a life in my stomach. That's when I'm like, I'm glad I did keep the baby once I saw the ultrasound.
It's my little friend, my little partner. We just go everywhere together. And I don't know. I just thought it was gonna be just all downhill. That's what I thought, and it's not that way.
There was no way that I could actually walk into an abortion clinic and have an abortion.
You know, I didn't want to keep her because I knew that I couldn't give her everything that she could possibly deserve.
There was no way that I could actually parent this little girl.
So I made the decision 8 months into it to give her up for adoption.
I knew that adoption was, I don't know how I knew, but I just knew that that was the only option for me.
It's the most selfless thing I've ever done and probably will ever do in my life.
I didn't know a lot about abortions. I did not know what they did.
I knew absolutely nothing. And when I went, they did an ultrasound, but I never got to see it. The monitor was never towards me. I never heard anything, and I didn't get any education.
In the first 3 months of pregnancy, the common procedure is called a dilatation and curettage, or a suction curettage. The instruments that are used during this procedure are a suction cannula or a sharp curette. The instruments are introduced into the uterus, and whereby the contents of the uterus are removed by curetting and suctioning.
All I heard was, if you decide to have an abortion, it's going to be a little like cramping, and it's a cell, and that was it.
But as far as the procedures that were involved and ultimately the risks to the mother and that type of thing, I was not aware.
The procedure that is done in the second 3 months of pregnancy is called a D&E, or a dilatation and evacuation. The procedure is very similar to the dilatation and curettage procedure. However, the instruments that are used are larger, and the fetus must be crushed at the time that the procedure is done, where the parts are removed from the uterus.
He gave me an injection to numb the inside and to open the cervix. And I didn't know, though, at the time what he was doing. They don't really tell you. They say to be still and be quiet. And I remember crying because it hurts.
If the abortion is performed only under IV sedation, the patient can feel the dilatation and also the instruments being introduced into to the uterus. Sometimes they can experience pain and cramping during the procedure.
And I told the nurse that it hurt, and the doctor said, well, you're a woman enough to have sex, you're a woman enough to handle this, so just be quiet.
It'll all be fixed, it'll all be better, and we'll go back to the way life was before. No. It didn't work like that.
Making a choice like this doesn't just end with the first decision. Each of these options has consequences. Some you will see and feel immediately, while others will take time to discover. It's very common to experience a sense of loss, regardless of which direction you turn. Many women speak of losing the possibilities that they thought the future held for them, while others are surprised to learn of the sense of loss that comes from not having their child with them. It's important for you to know what will be happening to you in the months and years to come as you make your decisions today.
I don't know, I had a lot of friends tell me I shouldn't, and then others that told me I should, and friends who had it done, and friends who had babies, and it was just a lot of opinions, and you just have to decide for yourself.
Of course, everybody toys with the idea of abortion. It would be a quick answer, but the heartache afterwards, I couldn't fathom.
My daughter's 13 years old, and I know exactly where she is. I know where she's in school. I know what she's doing. I get pictures, and that is a true comfort. She is absolutely amazing. She's precious.
I'm adopted. I was, adopted as well, and my mother gave me the greatest life, and she gave me to parents who loved me, and how selfish is that of me to take that away from somebody else, and it's not mine to take or give.
So after she was born, I knew that I'd made the right decision. It was difficult, and there certainly times when I missed her every day. I cried, and I was very emotional for a while, but I knew that I'd made the right decision.
You know, you have this horrible feeling that you're in the hospital, you're in labor, and you give your child and you never see it, and that's it. You don't know what happens, and you never know, and you live for the next 25 to 50 years going, okay, 20 years ago I gave this child up. I wonder where he or she is. And adoption, thankfully, is not like that anymore.
I would most like for people to be aware that adoption is an option. It is an amazing option.
I was not aware of the after effects of abortion, physical after effects of abortion.
The first complication is possible perforation of the uterus, whereby the sharp instruments that are used to perform the procedure can cause a tear in the uterus. If the instruments are introduced into the abdomen, the abdominal contents can accidentally be torn, such as the bowel, the ureters, which is the tube that runs from the kidney to the bladder. And this may require the patient to have a exploratory laparotomy, where the surgeon may have to open the patient's abdomen up to repair any of the injuries.
There was hemorrhaging involved, and it was just a very difficult situation for me. And I had no idea that any of that was even a possibility.
Another complication of an abortion is hemorrhage, whereby the patient can bleed from the procedure, requiring possible blood transfusion.
After I had the abortion, a friend of mine, one of my college roommates, we went back to the dormitory, and I didn't let my father know, of course, what I had done. So I stayed at the dorm with her, and she came back from class and saw that I was still bleeding, and we ended up having to go to the emergency room.
The third possible complication is an infection as a result of the contents of the uterus not being fully removed, whereby then the patient may need antibiotics. As a result of infection, sometimes a woman can develop further complications later on when she desires to have pregnancy, where she might not be able to carry a pregnancy because of the uterus being scarred.
My husband and I are not able to have children. The doctors told us that we'll be lucky if we have about a 2 to 4% chance of ever having children. And so that was part of the devastating effect of having an abortion, was that there was some scar tissue. And that was one of the results of that.
Another complication is cervical laceration, whereby when the dilators are placed, the cervix can be lacerated. The risk factors with subsequent abortions in terms of carrying the pregnancy in the future includes possible increased risk for tubal pregnancies, low birth weight infants, and early miscarriages.
I did not know that having an abortion would have the scars that it indeed had on me, mentally, psychologically.
I just felt dead. I don't know how else to describe it. I felt so dead inside. And so I went through college just this kind of not living.
Shortly after my second daughter was born, I got pregnant again about 6 months later. And there was no way I was going to be able to have another child that soon.
I would play a role. I would be whoever I needed to be for whomever I needed to be at that point in time.
And again, I went to the same abortion clinic, and I went through it all over again. And I think that's the one that I became very angry and bitter over.
Went ahead, had the abortion, and it just went numb afterwards.
I didn't cry this time. I hurt tremendously. I had physical pain. It was horrible. But I was angry.
It was painful, but it was not tragic or traumatic like some other people have told me about, which I think made it harder for me later because it wasn't right there. I was able to just pretend nothing ever happened.
I had gotten to the point where I couldn't even look people in the eye. I didn't want to be in public places with my kids. I didn't like going to school functions, or I couldn't volunteer at the school. I couldn't because I wasn't worthy. I was ashamed. If people only knew.
I was about to be married, and I had walked into my fiance's home, and he was reading a book. And I said, "What are you reading?" And he says, "Oh, I'm reading this book about children who are aborted." And I just burst into tears. And he's like, "What's wrong?" You know, he couldn't understand why I just started crying. And I said, "What does the book say?" He said that that the children are in heaven, and they pray for their mother.
I've been there. I know what it feels like to be in that position of not having any choices. But there are choices. And there are things that, there are places and people that can help you now, that so you don't have to go through the pain and suffering that I went through.
So, where do you go from here? Of course, the answer depends on the choices that you make. As you can imagine, all of the women who have shared with you today experience the same anger, grief, and fear that you may be feeling now. Some of them made choices that they feel good about today. Others didn't. You can make a decision that you can feel good about if you take the time to consider all that is going on inside and outside your own mind, body, and heart. We know this is a hard time and a difficult decision. We're here to help. You are not alone.